Hello all, thank you for joining us for our first installment of the 2017 Root Cause Coalition webinar series. Before we get started, I want to run through a few features of our webinar today. All of our attendees will be in a listen-only mode for the duration of the webinar. At the end of the webinar, our panelists will be answering audience questions. If you have a question during the webinar, please type your question into the questions pane on the webinar control panel, located at the right side of your screen. This webinar is being recorded and will be available for download on the Root Cause Coalition website later this week. Thank you all again for attending, and at this time, I'm going to turn it over to our presenters.
Thanks, Monique, and hello, everyone. This is Jason Gromley from the Root Cause Coalition. I want to thank everyone for taking some time to be with us here today to talk about advocacy and how we can move forward collectively in these quite uncertain times. So I'm very happy to be joined today by Rachelle Wenger from Dignity Health, who also is the chair of our advocacy committee here at the Root Cause Coalition. So Monique, if you can take me to the next slide. Monique? There we go. Oh, went one too far. I want to talk a little bit about the Root Cause Coalition, who we are, and kind of how we came to be. So the coalition is fairly new. We were started as a project between ProMedica, a health system in Ohio and Michigan, and the AARP Foundation in October of 2015. And have been joined over the last few months by a lot of organizations who are genuinely interested in addressing the social determinants of health, especially hunger as a health issue, through collective engagement, through advocacy, education, and research. And that is what the coalition is really focused on and working towards, is bringing together cross-sector partnerships and community groups to really get to work in the communities, focused on the how to make change, not necessarily the what or the why, really focused on that how. On the next slide, Monique. And our coalition is really made up of a national group of folks. They are coast to coast in almost all 50 states in Washington, D.C., bringing together community nonprofits like food banks and hospitals, health insurers, also bringing together other nonprofits in their communities that are working towards creating better health opportunities through addressing not just hunger, but also addressing the other social determinants of health. So before we go too far here, I want to overview what our agenda is. So how does the current environment, post-elections of 2016, and the presidency of President Trump, as well as a Republican-controlled Congress, what does that do to our priorities, but also the possibilities that exist based on those responses? And then how do we make a difference by working together? This is something that I care very passionately about, the motivations behind what drives organizations, but also people towards working together and towards accomplishing a communal goal. And then what issues are we going to target? What kinds of things should we be talking about with our elected members of Congress, but also in our own communities with our other stakeholders and partners? And then we'll finish with, how do you get started? What do you do? What are your next steps after this webinar is over? What should you be doing in your own organization, in your own community, to make the biggest impact possible? So with that, I'm going to turn it over to Rachelle and let her talk a little bit about our current environment and where we go from here. Rachelle, I think you might be on mute.
Hello.
There you are.
Wonderful. Hello, everyone. Thank you, Jason, and my deepest gratitude to each of you for joining us today, for your leadership and your commitment to advocacy. The results of the 2016 election certainly is calling into question in new ways where healthcare transformation is going. Prior to election, Monique, for some reason my slide isn't turning over. There you go. Sorry about that. The results of the 2016 election certainly is calling into question where is transformation going. Prior to election, healthcare was well underway in reform efforts with organizations having solid plans in place, and some of our organizations have plans in place that are 5 to 10 years out. Many of these organizations and various stakeholders supported the Affordable Care Act not because it was a perfect law, but because it put the nation on a path to achieve the triple aims of elevating quality of care, curbing healthcare cost, and improving population health. Prior to ACA, I don't think I need to go into this too much with this group, but the nation's healthcare system was very much characterized as broken, fragmented, and unsustainable, leaving millions without access to affordable care. In 2010, the uninsured rate was at 16%, and by mid-2016, it dropped to 8.9%. Since the ACA's passage, more than 20 million lives have gained coverage. And from where we stand today, it's really quite inconceivable, if not altogether unclear at this point, how going backwards could be a possibility, stripping as many as 30 million people from losing coverage under one version plan that we are aware of to repeal ACA. The healthcare community recognizes there is more work to be done. Gains made to expand coverage must be maintained, if not improved upon, as many in America are still without coverage and meaningful access to care. I think it is fair to say that the ACA was never expected to be fully implemented without adjustments and repairs. Even as ACA regs were being promulgated, the healthcare community were actively advocating to make meaningful and more workable the law. I would submit that the healthcare community continues in its resolve and in its commitment to transform the nation's healthcare system. While change is certainly upon us under a new administration and Congress, there is much we don't know to date regarding the fate of the ACA. What we do know is that the fundamental need to address social determinants of health remains, and that the healthcare community stands at the ready, planning for the continuation of federal health care policies, and also advocating for tweaks to the ACA to transform the delivery of health care, moving it from volume to value and enabling providers to better address social determinants and the needs of the communities that we serve. More than ever before, the challenge and opportunities are before us to deliver on the promise of care and to make plans that reflect not only our organizational values, but also those enduring values in which our country is founded. Working together, I truly believe that we must build on progress, because for the work of health and healing, it is not a bipartisan issue by any means. It is certainly something that is so core to who we are, and I would suspect that, you know, going forward we can really ground ourselves in the things that are so important to us in all that we do in our organizations. Monique, next slide, please. There you go. Second week into the Trump administration, I want to acknowledge the mix of emotions and uncertainties, the hopes and capacities, including the capacity of courage that brings us into this Monday. I also want to especially recognize the palpable fear, anger, insecurity, and suffering we are witnessing in the communities we serve. There is so much to take in and to have to cut through. There seems more questions than answers and a clear path forward. Before I walk us through the details of what we do know of the current landscape, for us in the social determinant space, the priority has always been and will always be the call to service. While we are in the precipice of changes, the focus on health and our healing mission does not change. In fact, I would submit it as what binds us into greater focus and inspires us to move forward from here. Next slide. How we continue to move forward with our work will be guided by values rooted in community and in our common humanity. I want to take you through the Congressional Review Act of, or the CRA, it certainly is something that will help us to understand how the rule of law will impact and determine the course we'll navigate. The CRA gives Congress 60 legislative days, and based on the calendar, Congress can go back as far as May 30th, 2016 to overturn regulations. CRA not only repeals the rule, but it bans an agency from issuing a substantially similar rule in the future. Rules at risk include those dealing with clean air and water, tobacco, school lunches, adult feeding programs, overtime payments, menu labeling, and financial protections for low-income individuals. A lot of these that are the focus of our work day in and day out. Next page. How will ACA repeal our work? Well, what we do know is that for us in the social determinant space, especially on the healthcare side, ACA repeal is that elephant in the room. It certainly is taking up much of our attention and focus now, and yet there's so much we don't know. So what is it that we do know? The House and Senate have passed language to repeal many parts of the ACA through a process called reconciliation that isn't subject to a Senate filibuster. The House has begun drafting the budget reconciliation bill, which will include specific funding reductions. And once this language is final, the House and Senate will vote on the bill. And again, only 51 votes are required to pass budget reconciliation in the Senate. Republicans certainly hope to send the final legislation to President Trump by, we are hearing, by February 20th. Republicans have been running on the ACA repeal for years and are poised to deliver on their campaign promises. Republicans have 52 seats in the Senate to the Democrats' 48. And to prevent a repeal of the ACA, Democrats would need 51 votes. Democrats currently have unanimous support for voting no on repeal, so they would need 3 Republicans to join them, which is an unlikely event. President Trump spent his first week in office issuing several executive orders that will impact not only pending regulations, but also the Affordable Care Act's future. And though the orders did not contain specific detail, more information will likely be provided once the new Secretary of the U.S. Department of Health and Human Services is confirmed. Confirmation hearings for Price nominee of the Secretary of HHS were held last week. He did not shed much light on his plans to proceed with the repeal or replacement of the ACA, other than to observe that the Centers for Medicare and Medicaid Innovation would likely remain, but with a different focus. Congress, as we know, has several hearings on the ACA scheduled for this week, and we also know that that congressional leadership promises a smooth transition from repeal to the replacement of the ACA. What this transition looks like is very unclear, creating a lot of confusion even among congressional Republicans. It is critical that we stand united in our message to urge that a replacement plan must simultaneously accompany repeal. We know that Republican members share the concerns of repealing the ACA without a meaningful and viable plan to accompany it. Next slide, please. How will ACA repeal affect our work? Well, in the short term, and I believe this certainly applies to both healthcare providers, the public, researchers, elected officials, and the administration, there is that danger of repeal sucking up all of the attention. And it really brings into focus that our collective voices together must ensure that we shed a bright light on those we serve, and that they remain at the center of the debate. Midterm, we are certainly looking at how it is that we could ensure that social determinant of health interventions remain part of that conversation. And in terms of what is far out into the horizon, we must continue to move to a risk-based healthcare system. ACA repeal and replace won't change that direction. There is certainly much work ahead. we are quite concerned about, what some of the proposals have been in terms of repealing the ACA. We're concerned about, individuals losing coverage, the loss of access to basic preventive care, elimination of essential health benefits like maternity and newborn care. And what is near and dear to us in the social determinant space, of course, is the loss of public health funds, which provides about $14 billion to improve public health and chronic illness. CDC would also lose about 12% of its budget, and states would lose more than $3 billion in grants and other programs. Now we know that we have lived in a political landscape that has been quite toxic around the ACA, and it's been one of the largest challenges that we face in moving more robustly in changing healthcare policy to better address the social determinants. We have oftentimes worked around our own issues, have siloed ourselves in our advocacy work, talking about, our own issues and priorities, healthcare talking about their priorities, hunger relief organizations talking about their own, housing advocates, etc., their own. But I think we certainly have an opportunity to change the course of things to come. By working across sectors, sharing common priorities, and really being smart advocates, we can influence what comes next. And so what does good advocacy look like? We know that we all have vital interests at stake, but how do we make the most of our resources and time and maximize our efforts together? Advocacy is our tool, and it takes many forms. We can certainly work together to do direct lobbying, do letters, phone calls, submit testimonies, comment on regulations, continue to educate our elected officials. Many of them are freshmen in this new Congress. We have media available to us. I think that we have to really focus on the touch points that we are that are immediately around us, from our families to what is going on with our neighbors in our neighborhoods. How is it that we can really get to our elected officials in their districts? How is it that we could move legislation at the state level? There are many forms of advocacy that we can certainly employ. Next slide. How does cooperation advance us all? Our work really is to help connect the dots between the various social determinant issues, because all of it matters. The way we language health must show the exquisite interconnectedness of determinants to healing. We know so well how studies show that someone who has no access to affordable transportation is more likely to be low income and have greater difficulty accessing fresh, nutritious food. They are at a much greater risk of developing significant but preventable chronic health conditions like diabetes. We also know that someone who lives in a crime-plagued neighborhood with poor education, in a poor education system, is much more likely to drop out of school, experience harmful stress, and develop significant, but again, preventable chronic health conditions like depression. And then there's the issue of homelessness and the lack of permanent supportive housing, and how that impacts the way in which one enters the healthcare system and drives up readmission and the cycle of ill health. We believe intimately that there is a path forward to address social determinants and the injustices we've yet to overcome. We know that together we can speak with one strong voice, deepen further our language and our understanding of our collective motivations. I would want to just end here by saying that all of our work is important. And we know that there is a lot of distractions and a lot of noise and a lot of uncertainty and chaos that is certainly upon us right now. And I would ask that we continue to remain grounded in our healing mission and the work ahead that calls us to really bring to life the values that we so cling on to and that inspires us to move forward. With that, I'll stop here, Jason, and turn over the webinar to you.
Thanks so much, Rachelle. And I think that was a good backgrounder and kind of looking forward. But I want to talk a little bit more about cooperation and what that means and then the motivations behind it. So we all know that our organizational missions are grounded in the work that we're all trying to accomplish in our communities, that they are there to serve the folks in the area and in our communities and give them access to whether it is affordable health care, whether it is access to fresh fruits and vegetables, nutritious meals, transportation, housing, all of the things that are intertwined in the social determinants of health. But motivations internally and motivations externally are oftentimes things that we don't really think a lot about. And so the big issue for me here today that I want to make sure that I ground you in is that even within your own organization, the folks on this webinar have a different motivation for being here than the CFO or a social worker or a case manager or even a physician within a hospital. So you have to understand how those different motivations work together to really drive an organization forward. And understanding those motivations within your own organization is going to help you understand the motivating factors amongst your community partners as well, among your elected officials, among all of the organizations that are working together to drive sustainable change and improve the lives of the folks in the community. If you're not understanding those motivating factors, then we're not going to get as far as we could if we all work together. So how do we identify what's motivating ourselves, what's motivating others within the community, and how do we use that knowledge to drive the conversation forward? My catchphrase, I guess, is that you have to get rid of the warm and fuzzies. You have to get rid of that feel-good stuff about your mission and about why you're here and start thinking about it from the real core business case, which helps not only understand how to convince somebody in the CEO's office or the CFO or a program director, but it also will help you convince funders, it'll help you convince your elected officials of why this is so important. So just a few examples that I run through. A hospital's driving force to get engaged in this work may be pressure from the IRS or from state tax authorities to be more engaged and give more back to the community. A food bank may be concerned about obtaining enough resources to meet the demand that they have in the community, so they may be looking for partnerships or opportunities or funding streams to ensure that they have access to those resources to meet the need that is coming through their doors. Nonprofit may be interested in future grant opportunities or even meeting the opportunities that they have in front of them now. And then a trade group may be interested in opening up new markets for their members. So we have to remember that all of these things are valid reasons for social determinants, interventions in social determinants of health from different kinds of organizations. But not all of them are going to drive the organization to address things in the same way. So how do we speak as one? How do we take all of these different motivating factors, lump them all into an advocacy strategy that's going to work for all of us at a state, local, and federal level? Well, speaking as one doesn't mean that we all have to go and talk about the same issue in the same way. But it does mean that different organizations should be working together to tailor an advocacy strategy that's going to bring the right resources back to their community, whether those are state grants or local philanthropy dollars or federal programs. We have to make sure that all of those things are in alignment because we are all in this together, and if we're not all pushing together and working together, we're not going to get to the finish line as quickly as we could. So I kind of laid out three ideas here, all dealing with your elected officials and a mythical program X. The first one is if you go and you're doing direct advocacy, or you're doing a letter writing campaign, or you're doing phone calls to an elected official for funding for that program because it, quote unquote, helps people back home. It's always important to ground things back home in the local area. So that's an okay advocacy strategy, but it's not really going to convince them that they need to make this a priority. Now, if two organizations are from the same sector and they're both talking about that same program to the same person, but they tweak it a little bit and start talking about how it improves the health of people back home, you've now connected to something that elected officials up and down the ballot, whether it's local officials, whether it is a statewide or a national elected official, they care about health. It's something that they can point to and say, we helped achieve this improvement in the health and well-being of the constituents that we serve. So connecting your mission back to the health of those people is an important tool. And then a great one is three organizations and having them be from different sectors, talking to an elected official about the same program and how it improves the health of people back home, lowers healthcare costs, and improves community health. There are so many interventions in the social determinant space who can meet all three of those, but there are also a lot of federal programs that folks don't often think about the healthcare implications of them and how they are going to impact the long-term health, well-being, and the health spend of that community. So we want to make sure we connect it back to all of those things, and having it come from more than just one organization or two, or even from one healthcare sector, or from the insurance industry, or from a community nonprofit. They're going to listen to all of us, but when we come to them collectively and talk about these issues from a broader standpoint and show them the wide range of organizations that are interested in addressing the social determinants of health and the opportunities we can all achieve when we work together, it's much more likely that we're going to get their attention and also their interest in helping us move forward. So how do we use a common language? So making the local case, I mentioned this a second ago, but it's important to ground yourself in what's important to the member of Congress, what's motivating them. So it's not just important to understand what's motivating yourself or your own organization or your community partners, but understanding the motivation of your elected officials is probably government 101 and not something that I need to share here. But elected officials, people don't run for Congress or mayor or even a statewide office because they just want the power. Maybe that's a little warm and fuzzy of me to think so, but most elected officials are there because they want to help people. They have a vision and ideas about what that means and how to move forward with it. But sometimes those are ill-informed, or they're not seeing the full picture. And it's our job to understand what's motivating them, what those core beliefs are, and how we can frame our message to meet them. So they really do genuinely care about the people that they're serving, and you have to go into any conversation with an elected official with that understanding. And they do care about getting reelected as well, so you have to know how to define your message in a way that's going to speak to their core motivations and really drive a case home for them about what they should be doing to help you better serve the community. The second thing here, defining what you mean by a social determinant of health. This is something that I don't think there's a single person that's on this call who doesn't understand what the social determinants of health are, that isn't aware that it's a big issue for a lot of the folks in the communities that we serve, that they're interconnected, that things like housing and education, job security, transportation, good nutrition, that those are things that truly challenge an individual's ability to not only succeed, but also their ability to maintain quality health. And our job is to frame that out for our members of Congress, for our local and state elected officials, so that they can understand how all of these things are connected to each other, because they hear from tons of people every single day on all of these issues, but they aren't being connected. failure, and that's an advocacy failure of our community, of all of us who talk to them about these issues, because we haven't grounded them in a true, detailed understanding of what social determinants of health are. So we need to make that change if we're going to get anywhere with our elected officials on these issues. And then the third thing here, discussing an issue's interconnectedness with individual and community health. I mentioned this in the last slide. We want to make sure that we are taking things that may not be obviously health related, like quality housing programs, like heating assistance, like temporary assistance for needy families, so temporary cash assistance. How you connect those things back to the overall health of those individuals, the overall healthcare spending of those individuals is really important, because you're not going to have a ton of time with your elected officials. They are busy people who try to squish in as many meetings as they can possibly have in a day so that they can say that they met with a bunch of constituents about an issue. But we have to make sure that we are giving them the detail and the local impact on that healthcare outcomes that is going to help them make a decision that will eventually help us better serve the communities that we are residing in. And then the last thing is, don't be afraid to raise unusual issues. And this is something that in my time doing government relations at the federal level, never ceases to amaze me how many times a staffer will sink their teeth into an issue that they don't hear all the time from a group. So whether you're a healthcare organization going in to talk about the issues that you're facing with folks not being able to access the Supplemental Nutrition Assistance Program, the SNAP program, or you are a community organization, a food bank, going in and talking about how Medicaid expansion helps the community partners that you serve. It grabs their attention because it's not the typical thing that they're used to hearing. It's not a bad thing to surprise a staffer. It deepens their understanding of an issue. It shows them that a wider range of organizations that they didn't necessarily think were concerned or engaged in these efforts. It reminds them that this is broader than one interest group or one sector of the economy, that lots of these programs are interconnected. And that also winds us back to those social determinants of health and how all of this is connected and can help us reduce healthcare spending, but also help improve the health and well-being of those individuals in the community. And then the last thing I have on this slide here is a little asterisk about remembering that these are real people, but you also need the data to sell it, not necessarily to the person that you're talking to, but so that they can then sell it to their boss, and then their boss can sell it to theirs, and so on and so forth, so that you can have a more sustained impact than just one conversation. And what this means for us is going in and talking about these issues needs to be a real collective effort of bringing together stories of community members who are immediately or eventually impacted by these issues, how it's going to impact them, and how either the dismantling or the implementation of a certain program will help or hurt those individuals. And being able to connect those data points and that information back to real lives and real people back home is the surest way to get more information from that individual who you're talking to, but also get them to be your champion and be your advocate. They're probably not going to remember the specific numbers you throw at them, but they will remember the story that you told them and how it impacted those individuals. And then if they need those numbers, they'll reach back out and get them from you. So what issues do we target? This is something that our advocacy committee talked a lot about. This is something that folks in Washington, D.C. are talking a lot about. What's the low-hanging fruit? With all the noise, all of the changes in the political environment, and so much that we could focus on, where should we start? And where can we collectively have the biggest impact? The first one is pretty obvious, the ACA replacement, and the repeal and the replacement is probably the biggest thing on all of your minds. It's a politically toxic issue. It's something that is really challenging to all different kinds of organizations to figure out exactly where they're going to fall on this issue and how they're going to help ensure that the resources are available to the communities that they serve in whatever final product is released. And then the second one is the Farm Bill. And for all of our healthcare folks on the phone, this is probably something that you aren't as familiar with. Just like the ACA is probably not something that folks who are not in the healthcare space are familiar with all of the intricacies of how that's going to work. And Rachelle did a good job of talking a little bit about that before. So the ACA, just really quickly, it doesn't matter what your personal or your organizational feelings are about repealing it. Given the congressional and the national climate right now, it is the most likely outcome, is that they're going to repeal the ACA and they're going to replace it with something. So going into Congress and saying, hey, listen, you can't repeal this, is not going to win you any friends on the Republican side of the aisle. And it's not going to really change the mentality of the folks on the Democratic side of the aisle. We really need to go in there and say, listen, you can't repeal this without replacing it because this is how it would affect the folks back home from me. I'm here to work with you to make sure that my community is taken care of because they're the people you're here to serve, and we want to make sure that we're giving them the best possible opportunities based on whatever replacement comes out of this. And the truth remains that members from both parties are concerned about what comes next. What are the next healthcare programs that are going to come out of the federal government? What kind of what kind of replacement are we going to be able to achieve to keep people on their insurance, to give them more options, to give them more access? They're concerned, and that's an opportunity for us because there isn't an answer yet. And we have the opportunity to have a quick impact on how they formulate their thoughts on these issues. And then the ACA is important, and we have to target it because it touches everything we all do. It affects everything from public health and access to care to opportunities and the flexibility of the care that's offered and the community partnerships that can be developed. So we have to be engaged in that replacement. And then on the farm side, nutrition is a core social determinant of health. If you don't have good, nutritious food and access and enough of it, you're going to have worse health. That is the reason that it is one of the earliest things that most healthcare partners have gotten engaged in. It's the reason there are nonprofits working on this around the country. It's a basic human need, access to safe, nutritious, and affordable food. And the Farm Bill includes more than just SNAP benefits. It includes a ton of other financial assistance products. It includes a ton of environmental programs, conservation, food safety standards, rural development programs, and other programs that are going to affect the long-term health and well-being of the communities that we're all serving. So we all have to be thinking about how all of these long-term things are coming together really around the health and well-being of the folks that we're serving. So how do we maximize our impact? Legislators understand that whatever they replace the ACA with is going to impact the healthcare sector. They know that the Farm Bill is going to impact community organizations, farmers, commodity brokers, all of those things. But what they don't understand, and I overviewed this a minute ago, they don't understand how all of these social determinant issues are connected to each other. And so that's our opportunity to surprise them. If a healthcare organization starts talking to their members about SNAP benefits, about summer feeding programs, about the environmental protections and conservation programs included in the Farm Bill, that's not what they expect. And connecting it back to the health and well-being of the community that they're serving is a surefire way to get their attention and also show them that you're not a one-trick pony. You're not there just talking to them about the same issue every year over and over again. You're really there to help them do their job better. And when you can show that you're a resource for a variety of different tools and that they can reach out to you and connect, that's a much better opportunity for you to be even more engaged with them. And so when I think about the opportunities that we are looking at here in the ACA especially, while repeal is probably inevitable, we should be advocating now for no repeal without an immediate replacement. And that's because if Congress moves forward with their repeal and delay, where they decide that they're going to repeal the ACA, but they're not going to implement a replacement until later, sometime down the road, 2 years, 3 years, something along those lines, that's going to create a lot of uncertainty in the marketplace. It's going to create a lot of uncertainty not only for healthcare providers and payers, but also for patients and for community organizations who are relying on the programs within the ACA, not only to shore up funding for themselves, but also to give access to their community partners, their patients, the people they're serving, to get into a healthcare facility and have access to insurance to pay for it. We can't allow that to move forward, repeal without a replacement in place. And so that's what the message you should be delivering to your elected officials now. As far as our replacement priorities, from the Root Cause Coalition's perspective, there are two really big things. Number one, we have to ensure continued patient access to quality care. That means a maintenance of the Medicaid expansion as a vital safety net to millions of the most vulnerable. It means that it has to maintain strong protections in the essential benefits package, pre-existing conditions, coverage of preventative care. In addition to those key protections, though, we also have to keep in mind the work that the Innovation Center is doing, prevention funds, providing necessary resources for addressing those social determinants of health. We have to make sure that we are keeping all of these different things in our minds as we're talking to our elected officials. And one of the things they love doing is saying, well, what's the one thing that you can't do without? And my pat answer to that is everything I just told you. It's not often the most satisfying for them, but all of these things are so interconnected in the work that we're all doing together that we can't afford to lose any of them, or we're going to be a couple steps behind where we need to be. And then the other thing is, one of the biggest challenges that healthcare providers have faced is we know, and it's becoming more and more common knowledge, that social determinants are affecting the long-term health and well-being of those community partners, of those individuals that we're serving. But there haven't been a lot of opportunities for healthcare providers to reach out into the community, use their resources to drive a conversation forward, and then the resources to be able to continue those programs and expand them. One of the opportunities that we have in a replacement, now that we're moving in that direction, is to create a pilot project or a program within the ACA replacement that allows providers to be reimbursed for their social determinant screening and referral services to community partners so that they can get the resources that they need as well. And that's one of the things that we need to be talking to our members about, because as they craft this package, there are going to be a lot of opportunities, especially for members who are dealing with healthcare on their committees, to insert pieces and pilot projects and studies that will help us do our jobs better and create the framework on the federal level that enables us to expand these programs down the road. So how do we advocate on the Farm Bill? And the Farm Bill, I will admit, I do mostly healthcare outreach, government relations work on the healthcare sector. So the Farm Bill is something that was rather new to me until just a couple years ago when I started working with the Root Cause Coalition. And the Farm Bill is something that touches so many different pieces of the legislative framework, of the healthcare framework. And it's surprising that not more healthcare providers and more insurance companies are advocating on it, because it does affect their ability to offer long-term savings to the healthcare system, but also to avoid long-term costs to themselves. So it's complicated, it's dense, it's sometimes controversial. Oftentimes you have a debate between liberals and conservatives on how much they're going to cut one program or another. But overall, the legislation brings together things like the SNAP program, nutrition programs, with crop insurance and conservation programs, commodity programs, and everything else that has to deal with agriculture in the United States. The last Farm Bill, the Agricultural Act of 2014, doesn't technically expire until 2018, about mid-year. But the Farm Bill had a couple of mistakes and issues that members, especially from agricultural states, the breadbasket of the country, are really concerned about. And so there's been pressure mounting to address it before next year. So there are two options here. They can either patch the current Farm Bill until next year and continue to work on drafting that larger package and introducing it next year, or they can attempt to draft and move a full Farm Bill in this year. The most likely outcome here is the first one, that they're going to patch it and then move the Farm Bill next year. Just for reference sake, the last Farm Bill was 2 years late. They didn't issue it until much later than they had expected because it was much more controversial than it usually is. So the Farm Bill is also full of a ton of targeted projects that members have thought, hey, this might be a good idea. We've heard from constituents that we may want to try something a little bit different. So it's included things like incentives to pay for food delivery services to the elderly, grants to improve job readiness and employment for low-skill recipients, double up food bucks for fruits and vegetables, and programs targeting military families and the disabled. That's going to be important because that's a real opportunity for us to test out some other things in the social determinant space that might be possible if we're all working together. So one of those that I'm really thinking is an opportunity for us outside of protecting the existing programs is better alignment of our nutrition programs with other federal programs that are targeting low-income communities. This is something that is really key if we're going to have a long-term impact on the social determinants of health, but also the health and well-being of the communities we serve. We have to be aligning the programs that are getting federal dollars, not necessarily going in and always asking for more in federal money, because frankly, it's just not there right now. Members of Congress on the conservative side just will not budge, and it's an electoral reality for them that they have to reduce federal spending. So when we go in there and just are constantly singing the same song of we need to expand these programs, we need to ensure that we have more resources to serve more people, and we're talking about the programs as if they were just a piggy bank that was unending. That turns a lot of potential allies off. It loses us the opportunity to utilize the resources that are already there in a more effective way. So in the second bullet point here, one of the things that we are interested in seeing is if we can convince members of Congress to allow the use of existing resources to address the most basic individual needs, address those social determinants of individuals by providing flexibility to communities and to nonprofit groups. And that includes things like directing existing temporary assistance for needy families, or TANF funding, to address social determinant of health programs that are proven to assist low-income individuals in moving off of social programs and getting employment and retaining that employment and moving up the economic ladder. That is something that there has been a lot of interest from members on both sides, is how we can do the programs in these communities better and better utilize the resources that exist for them. And then the last one here, studying how access to healthy, nutritious foods impacts the long-term health outcomes and spending. This is something that members don't fully understand, and frankly, I don't think the community fully understands how all of these things, especially nutrition programs, really impact the long-term health outcomes and spending that we see. We have a lot of pieces of information. We have a ton of resources available that can tell a compelling story. But having the blessing of the Department of Agriculture, having the blessing of an organization like the CDC, and having this be a federally backed study not only provides the resources to study it, it also gives us the the stamp of approval from a governmental entity saying that this is how we can reduce overall healthcare spending in the long term by addressing the immediate hunger and nutrition needs of the communities that we're serving. So those are the priorities that we think are really ripe, that will provide a lot of momentum and opportunity for our membership, but also all of our allies in other communities to reach out to their members of Congress and make a big impact on them that's also going to make a big impact on the communities that we serve. So what should you be doing next? What's the next step in this process? Well, the first thing is to share these priorities with your team and organizational leadership, because every organization is going to look at these things differently. Our advocacy team picked things that were really focused on collective mission, that were focused on things that we can all agree on, so that we're all going in and talking with the same voice about the social determinants of health, about the long-term healthcare impact of these programs on our communities and our work, and the ability to help improve the lives of ordinary people right back at home that they're there to serve. So sharing it with them is going to be important to identify if it fits within your current advocacy agenda, if it is something that your organization is willing to put on that advocacy agenda and then share with their members of Congress. And then the second thing is discussing those priorities with your community partners, because if you remember, having a wide depth and breadth of organizations talking about these issues in the same way is going to be much more impactful for our members, for your members, and for our overall advancement of these issues. Showing them that there are a ton of people who care about this, there's a ton of organizational strength behind achieving these goals is really important. And then establishing a concrete advocacy plan that includes that coordinated outreach. Are you going to do face-to-face meetings? Are you going to write letters, do phone calls, testimony, all of the things that Rachelle talked about earlier to those elected officials? Are you going to host a roundtable meeting where you all come together to chat and share those issues with that member of Congress, a site visit, the kind of things that really get their attention and bring them down to a level where they fundamentally understand your issues? And then the last thing is to just get started. Taking that first step is often the hardest one. If your organization hasn't done advocacy in the past, I can tell you it's not as scary as it seems. Members of Congress care about hearing from folks back home and are oftentimes more than willing to listen to the work that you're doing because it's going to help them better sell their story as well and meet those motivational factors that they have. And so how can we help? At the Root Cause Coalition, we truly believe we're all in this together. Anything that we can do to help drive your message, to provide information, we're more than happy to do. Our website is up on the screen right now. If you haven't checked it out, please visit there, see if there's not an answer on there. Please feel free to reach out to myself, to Monique, and we'll do our best to answer your question or connect you to one of our partners who may have the answer for you. So I know, Monique, I went out a little bit over the time I was allotted, and we don't have a ton of time left for questions, but I'll turn it back over to you.
Great, thank you. And thank you all to those who have submitted questions. We're going to get to a couple today. If your question does not get answered, we will follow up with you personally via email to answer the question for you. So the first question from Reese is, if congressional Republicans are confused by what the replacement plan of the Affordable Care Act will be, why do we feel it is unlikely for the Democrats to get 3 Republican votes?
That's a good question, Monique. And Reese, I will say that in the Senate, there has been a lot of pressure from moderate Republicans to ensure that they have a replacement plan ready for whenever repeal happens. That being said, those same Republicans are fully on board with repealing the Affordable Care Act. They are fully on board with moving past Obamacare and are in lockstep with Republican leadership on these issues in repealing it. Now, that doesn't mean that it's going to be repealed at the exact moment that leadership on the Republican side in the House and Senate may want it to be. it may be delayed somewhat in order to give an opportunity for a replacement to coalesce within the Republicans in the Senate. But it is still the most likely outcome. Does that mean that lightning can't strike and the ACA will be here to stay and they'll tweak it instead of repealing it? Certainly, that's a possibility, but it is not by any means the most likely outcome.
Great. The next question we have is from Jan, and she asks, where does the coalition stand on leaving healthcare insurance programs back to the states? Are there certain parameters being advocated for replacement?
That's a good question as well. I would guess that we're referring to Medicaid here, as opposed to other insurance, because the other insurance is typically handled by state regulators as is. The coalition hasn't taken a stance on this, and that's in large part because it's not a cut and dry issue for providers, for payers, or for advocacy groups. I think that there are some organizations out there that are doing really great work in this space, and we are more than happy to defer to them. If we tried to tackle all of these issues together, I don't think that we would get very far as a coalition. So we've tried to stick to the issues that we can have the biggest impact on and have the most agreement across our individual members. Rachelle, I don't know if you wanted to add anything on that, or I should have tossed the last one over to you as well to add anything.
I think you did a great job answering that, Jason. I mean, I would certainly say, there are opportunities for us to really try to protect what we have at the state level. I know that there's a lot of concern on state exchanges and the efforts that we've all made to expand Medicaid in some of our states. As far as TRCC is concerned, I think you're on point to say that, we are not at a place where there is just one policy position that we can take at this point in time, and I don't think it is our place at this juncture to be able to do that.
Great, Monique, I think we have time for one more question.
Okay, the last question comes from Mary Dale, and she asks if either of you know where the evaluation on the FI-NI grant stands.
Mary Dale, I'm going to keep this short, so we might be able to take another one. I don't know the answer to that question, but we'll look into it.
And it looks like we don't have any additional questions for the group. A few people asked some individual questions about the Root Cause Coalition, and we will respond to you via email.
Excellent. Well, we'll give one more second. If anyone has a question that they'd like to ask, feel free to enter it now. If not, again, my email is up on the screen, or you can reach us through the website as well. All right, with that, I'd like to thank Rachelle, thanks Monique, and thank all of you for joining us today. It's going to be an exciting year, and stay tuned. I'm sure that there will be updates from us, but also happy to answer any questions on how you can individually get involved or bring your organization on board.
Thank you, Jason.
Great. Thank you, everybody.